So we're here to talk this morning a little bit about EMDR. EMDR is the #1 treatment protocol for PTSD. So PTSD, of course, is post-traumatic stress syndrome. And how do we know if somebody qualifies, or how do you know if you qualify as having experienced trauma? Is the simple definition is that trauma is anytime we felt overwhelmed. So it turns out that most of us have, of course, been traumatized at some point in our life. And if we have been traumatized, again, the EMDR is the #1 treatment protocol for PTSD. One of the reasons that is it's also the most heavily researched. I forget the percentage-wise, but it's by far the most researched treatment protocol in mental health history. And the primary reason for that is that it's been utilized by the government for people coming back from battle, coming back from war. So certainly it's been researched, and the efficacy has totally been proven. And I can tell you from my experience as 30 years as a practitioner that it absolutely works. I've never seen it not work, and it's been miraculous for most people that are in a place where they can begin the process of treatment with the EMDR. So one of the things that's going to be on this video is I'm going to continue to explain what EMDR is and a little bit about how it works. And then we also have a person that's going to play the role of a client briefly. We're not going to do a whole session this morning. I will talk about what a session is, but we're not going to actually do a session. That may happen on a future video, but for now, I'm going to focus more on explaining the session and kind of the interaction that happens and what you can expect as a client as you experience the EMDR. So before we do that, I want to say just a little bit more about EMDR was discovered and founded by Francine Shapiro out of San Francisco. I believe it was 1987, so it's been around for a long time. It's not something that has just popped up recently. It's been here for 33 years. And the way that she discovered it in and of itself is quite amazing. I would highly recommend that you pick up her book on EMDR, again, Francine Shapiro, and she will talk about it extensively, how it works, why it works, how she discovered it, and it's an amazing story in and of itself. So that would be something I would highly recommend, is that you would check out Francine Shapiro and her website, and if you have the opportunity to read her book. I personally have been utilizing EMDR as a treatment protocol since 1995, and I currently am a trainer. I'm a national trainer for PESI, and I will be heading out on the road to do some training for them starting in November. I also do my own EMDR workshops here at Counseling Solutions, Bill Mason Counseling Solutions, and that has been proven to be successful. People are learning how to do the EMDR in a way that's hopefully the most effective way to learn it and therefore practice it. Having said that, I would like to now say a little bit about how it works and why it works. So we start out with, there are different ways. When Francine Shapiro discovered the EMDR, the EMDR actually stands for eye movement desensitization reprocessing. So when she discovered it, she didn't realize until later that what was actually making the EMDR work was the bilateral stimulation of the brain. So back in the day, she would have the client follow a pen back and forth, or a finger back and forth in front of them. And actually part of the problem I have with that as a way to utilize the treatment protocol is when you're talking about people who've been traumatized, then we ask that somebody be allowed to be 18 inches from them so they can utilize the treatment protocol. I personally found that to be problematic, so I didn't utilize it as much until we discovered that it's actually the bilateral stimulation, and then I'll talk a little bit more about that, about how we can create that in different ways than what it was once created. So at this point, I'll show you a little bit. So the bilateral stimulation of the brain simply means that basically one of the basic ideas of EMDR is that when we're traumatized, information gets frozen on the right side of the brain. So whatever the trauma event is, it actually causes us to be stuck on that part of our brain. And the right side of our brain is the feeling side, but it also involves the subconscious. And so one of the things that's important to know about the subconscious is that we don't know the difference. The subconscious part of us does not know the difference between the past and the present. So therefore, we can be triggered into a younger part of ourselves or a former part of ourselves, some previous event in the snap of a finger. And so that's part of the problem when somebody has PTSD is they can literally be triggered in the moment and think that they're back at whatever the traumatic event was. So the classic example that's probably depicted the most would be, again, somebody in battle and then they're living their everyday life, firecracker or something goes on and they get triggered and they feel like they're back at that space and time. But it also, that same dynamic can happen with unresolved childhood abuse. So that would be either physical abuse growing up, sexual abuse, emotional abuse, that anything that causes us to split off from our authentic self into a false self was traumatizing enough that would qualify us to be able to experience a benefit from the EMDR protocol. So with that in mind, the way that the EMDR works then is it turns out, here's another key fact, it turns out the right side of our brain and the left side of our brain do not communicate very well. So what the EMDR does is it actually increases the communication between the right side of the brain and the left side of the brain through the bilateral stimulation that's facilitated by what I prefer to use and what a lot of clinicians are now using is an instrument called a TheraTapper. So what happens is in this treatment protocol is the client will hold the TheraTapper, so I'll go ahead and hand this off to Elena. And actually, so she's holding, it's almost like a real small computer mouse. I don't know what else to compare it to. And you can hold it comfortably in your hand. And so you hold one in each hand. And then here the clinician has the control unit. And basically there's an on-off button. And so the first thing I would do when you're in for a session is I would ask you, is it working? So if it's working, that would mean it's going to buzz bilateral on both left hand and right hand. So I'm getting the indication that it is working, so we know we're good. The other thing I have control over, so I'm going to ask this question as well, is I can control the pulse rate. So I can slow down the rate of the bilateral stimulation, or I can increase it. And so I just simply I would ask you at this point, is that happening? Is it slowing down? Is it speeding up as I'm changing the setting? Indicating that it is. The other thing is I can control the pulse rate. So the pulse rate can be like a zzz, zzz, or we can make it longer. So it could be zzz, zzz, for example, or we can make it shorter. So basically, that is happening. I see.
Yes.
Yeah. So those are the settings. So I'm going to actually turn the TheraTapper off for a minute. It won't come into play until a little bit later in the session. So what happens literally is, as a result of the bilateral stimulation in the brain, information is then able to be communicated between the two hemispheres of the brain. So that's why at the end of an EMDR session, when we're working on a traumatic event, and basically, I want to be clear too, because it's there are a lot of different things that are happening with people who are EMDR therapists where they're doing, I believe, things that were never really meant to be done. So I'm not going to go into that right now, but basically what I'm thinking is this is considered single event EMDR. So it's one event. It has a fairly definitive beginning, middle, and end. And the good news with that is when we work on that event, that will be completely moved from your right side of your brain to your left side of the brain, literally reprocessed, and it will never have the power or control over you that it has previously. So you will never be able to be triggered back into that space. You will literally be free from whatever that traumatic event was. Again, whether it was something from battle or childhood abuse, car accidents. I work a lot with people who have been in car accidents or gunshots or any kind of violence that's happened against them. Again, the idea is if you've been traumatized, this treatment protocol will completely heal you from that trauma. So again, moving forward, I'm going to say a little bit about how this works and the order in which things are done. So in general, excuse me, in general, the EMDR has 3 different parts, or we might even say 4 different parts, but let me walk through them. So starting out, we begin with the relaxation, And for the most part, for you as the client, you're playing a pretty passive role. So you're sitting and you're getting comfortable and you lean back, and it works best if you close your eyes and get as relaxed as you can. And I'm going to walk you through a series of relaxation exercises to help facilitate you becoming more relaxed. So you can kind of get acclimated to the room and the process. And basically, for most people, that happens pretty quickly. So within a couple of minutes, you're at a place where you feel relaxed enough that we can go to the next step or the next part of the treatment protocol, which is called the container exercise. So again, we start with the relaxation and then we move right into, hopefully in a way that flows pretty effectively, right into the container exercise. So the container exercise is we have you visualize a container, and a container can be any size or shape. It can be constructed of any material. It can be any color. The most important thing about the container is it does need to have a lid. And the reason the container needs to have a lid is in this part of the EMDR session, I'm going to ask you to think of any stressors or anxieties that you may have brought with you that given day or today, and go ahead and visualize putting those into the container. So we literally will walk again. You're somewhat passive at this point. You're listening, and then I ask you to describe your container, as we can't move forward until you can describe it, and then you'll tell me what shape it is, what it's constructed of, what color it is. It's going to come right to you. It's going to pop right into your consciousness. You're going to know what the container is, and then I'm going to ask you to put everything in that container that you want to put in, the stressors and anxieties. And when you accomplish that, I'll ask you to put the lid on. And when you've been able to accomplish that, you're going to let me know. You're either going to verbally say okay, or you nod your head that you've been able to put the lid on. And then we're going to move into the next phase. So I've gotten the okay. Once I've gotten the okay that yes, the lid is on, the stressors and anxieties are put in there for now. Then we move to the next phase, which is it's actually a safe place relaxation imagery. So I'm going to instruct you to go to a safe place, and I'll give you some instructions with that. I'll say it might be a favorite vacation spot, or it can be a place that you create in your mind. But the idea of the safe place is it's a place where you feel completely safe, completely comfortable, as relaxed as you can possibly be. So most people typically, you pick whatever safe place you want, but most people typically pick someplace near water. As humans, we tend to feel most comforted around water. But again, it's wherever your safe place is. You're going to go wherever you feel comfortable in going. And once you get there, you're going to start to tell me about your safe place. You're going to describe it for me. And that way I know that you're there and that we're going to be able to go into the next phase. So these first three phases, really, in terms of time, with each person, it can be different. But the average amount of time is probably, we're maybe 15 minutes into a session at this point. So it moves relatively quickly, which is good news because we do want to spend as much time as possible on reprocessing the trauma. So the first session, I'm thinking maybe 15, maybe 20 minutes with these first parts. Actually, in subsequent sessions with people who've experienced the EMDR, a lot of times we can get there a lot quicker because you know what your safe place is at this point. You know what your container is, and you know how to put things in the container. You know how to talk about your safe place. And so typically we get there a lot faster. So, but right now I'm talking about session number one is a way of trying to explain EMDR and its power and how it works and why it works. So after we do the safe place imagery, and again, I'm walking you through that, and I'm talking, and you're listening, and we're moving forward with that. I have you then leave your safe place with the understanding that we're going to come back to your safe place. We're not leaving it. We're not abandoning it. Actually, part of the goal with good EMDR therapy is ultimately we want to help you realize that safe place exists inside of you, and that you can call on it any time of the day or night simply by breathing into that space, that safe place imagery. And I instruct you that when you do so, you will immediately feel calmer, more relaxed, and more centered. So again, I walk you through all that and use all that language, and it's proven to be highly effective over time, over the years. So at the point where you're in your safe place and I ask you to go ahead and leave it, I let you know we're going to come back to it before we're done with the session. I have you breathe it inside of you. We call on it, as I said, any time of the day or night, simply by taking a slower, deeper breath. And then I ask you to just begin to process back in time to go back to the beginning of whatever, to the beginning of whatever event you're going to walk through today, or whatever day that you're here. So I would instruct you to do that. You will go back in time slowly, as I said, calmly. And when you get back to the beginning of the event that you're going to walk through, you let me know. Now, I want to point out that through this part of the process, we've not turned on the TheraTapper. We're not creating the bilateral stimulation of the brain yet, but that's in the next step, the next phase. So at this point, I would ask the client to go back to the beginning of their event. They let me know that they're there, and then I would have them begin to talk about the event. Typically, when somebody talks about a traumatic event, some people may have never talked about this event before, whatever it is they're going to share. Some may have talked about it, but by definition, if it's traumatizing enough to recall, then there's a lot of feelings that are going to come up about whatever the event is. So we expect that, and we're ready for that, we're prepared for that, and that's part of the process. So a person walks to the event, and they verbalize it. So they say out loud what it was that happened. So probably the population that I work with the most is people that have childhood unresolved trauma or abuse issues. And so they typically will pick, you can pick whatever you want. You can pick something that maybe you feel like was not all that traumatic, or maybe medium trauma was created. Or some people will go right for a major trauma piece. And again, I think the way this process works best is you are your own guide, so you get to decide what event you're going to walk through. And of course, here as me as the facilitator will be here for you at whatever choice is made. And again, having had over 30 years experience as a clinician, I know how to be here for you and help you deal with whatever feelings that also may come up, because most likely some feelings will. So as we move forward, then I instruct you to move through the events. You're verbalizing it, and you go ahead and start, and you walk all the way through. So you talk about whatever it was that happened. And then when you get to the end, and for some people, this event may have been a minute. That was a little bit unusual. Usually they're longer. For some people, it might take 15 minutes. So we try to get the event condensed enough that we want to make sure we have time to work on the trauma and effectively eliminate it, if you will, or transfer it from the right side of the brain to the left side. By the way, the left side of the brain, why it's so important is it's the part of our brain that's rational. And what happens once the information's moved from the right side of the brain to the left side of the brain is we get a distance, if you will, we get an emotional distance from it. So we can have a memory and say, hey, yeah, that happened, I remember it, but I don't have that attachment of the traumatic response to it. So whatever level of anxiety or fear or whatever else may have happened as a result of recalling that memory is now gone. So I can think about it, but it has no power over me, is what I like to say. So we're taking the power out of the memory. At this point, so I have you verbalize, you walk through the event from beginning, middle to end. And then when you get to the end, you let me know. At this point too, when you start walking through the event, I turn the TheraTapper on. And so that's what's actually creating the movement from the right side of the brain to the left side of the brain. So the TheraTapper is turned on. I let you know that I'm turning it on. You become aware of that because you feel the vibrations happening bilaterally. And when you get to the end of the event, then we turn it off. I walk you back through a short relaxation exercise to help you kind of get regrounded, because there may have been some feelings that have come up. If you need some tissues, there's tissues available right next to you, and you take care of yourself in that sense, and you let yourself have whatever feelings, and of course all of your feelings are welcome here, whether we're utilizing EMDR or in a typical counseling session. So you walk through the event, I turn the TheraTappers on, do a little bit of relaxation and breathing, and then I ask you a question. And the question that I ask is designed to figure out your level of anxiety or distress, is the word we prefer to use, as you walk through the event. And we have you assign a number on that from 0 to 10, with 10 being totally distressed and 0 being no distress whatsoever. And you tell me whatever that number is, and we proceed from there. So after you let me know your level of distress, then I have you do just another 30 seconds or so of breathing and relaxation, and I instruct you to walk back through the event again from beginning, middle to end. So at that point, I turn the TheraTapper back on. You walk through the event again. It's the same event. We don't elaborate on it. We don't expand. We stay with it. We contain it, whatever that event was. And again, when you get to the end, you let me know. I turn the TheraTapper off. We come back and do some more relaxation. And then I again ask you what level of distress you're at. So basically, we repeat. The treatment protocol is repeated. And some people actually are amazed at the simplicity of it. I think it's hard even as a clinician to understand sometimes how the two things that stand out about EMDR, one is the simplicity, and the other is the fact that it's almost miraculous in terms of the effectiveness. So it's a very interesting combination of dynamics that are together in this treatment protocol. So basically what we're looking for here is when you can get through the event, and then when we come back through and I ask you what your level of distress is, we're looking to get you down to a 0. So you're not having a response, you're not having an anxiety response, or you're not experiencing distress as a result of having shared the event. So for some people that takes a certain number of times, for some people more, some people less. It's not a competition. It's not, no two people are alike, no two traumas are alike. The way that we're impacted by trauma is not the same. We can have family members that experience the same event with a different level of trauma. There's different factors that come in as to why that would be. But again, the most important thing is this treatment protocol works. So when we have the person down to the level of 0, then we're done with that event, and I instruct them to do a little bit more relaxation and breathing. And then we leave that event, and I let them know that we're going to leave that once and for all, that it no longer has any power over them, and we've successfully reprocessed it. And again, what that means is we've moved it from the right side of the brain to the left side of the brain, where it can be thought about without having any power. So we then go back to the safe place, and in that safe place, you relax again and enjoy where you are and really take it in and relax as much as you possibly can. And then we're almost done at that point, but we're not quite finished. So there actually is a fourth part. So I initially said 3, but it depends on how we group it. So we have the relaxation, we have the container, and then we have the safe place, and then we have the EMDR. So I guess we really could say there's 5 parts. And then and I'm going to talk about that final phase now. So the final phase is once you're back in your safe place, then I talk to you about. There was a question too that I didn't mention. There's a question after the first time you go through the traumatic event. I ask you what negative belief you held about yourself as a result of what happened, and whether or not you can think of what the answer to that question would be as you're watching this video. I can assure you that when you're here, if you decide to try this treatment protocol, you will know the answer to that question. Because whatever the answer to that question is something that's in some ways plagued you and or re-traumatized you for your life, your whole life since that event, depending on how long ago that was. So we asked that question. I asked that question back then. What negative belief did you believe about yourself? You'll answer that, and then we'll hold on to that. I'll hold on to it until we successfully walk through the reprocessing part. Now you're back in your safe place. I'm going to have you answer a new question. And this question is, what is the opposite positive belief you can have about yourself now that you've reprocessed this information? So again, you will immediately know that answer, or within a few seconds, maybe 30 seconds at most, you'll have an answer to that question. And you'll have a positive statement that will counteract that initial negative statement or negative belief that you had about yourself. And you will verbalize that, you will say it out loud. And then the final phase of EMDR is I will have you meditate on, or whatever word you like, I'm going to have you think about it at the deepest level possible about that positive belief. And I'll instruct you to take it in. You'll take it in mentally, you'll take it in somatically through your body. You're going to take, every part of you is going to believe this positive statement. So I'm going to give you that careful instruction with that. You're going to think about it. And then I'm going to turn the TheraTapper back on. So when the TheraTapper comes back into play for only about 45 seconds or so. And while it's on, you're going to be instructed to just take in that belief and believe that positive statement about yourself as much as you possibly can. So turn the TheraTapper on for about 45 seconds and turn it off. And then a little bit more relaxation. When I say that, I mean 30 seconds or so. And then I ask a different question. And this question is, as you were allowing yourself to take in that positive belief about yourself, on a different scale, this scale is 0 to 7. And on this scale, 7 would indicate that you totally believe your positive statement. And 0 would indicate you don't believe it at all. What number would you attach to your belief about your positive statement? So everybody's different. So most people, I think in my experience, it'd be a little bit unusual to have somebody say less than a 5 or a 6. But, it's whatever it is. It's your statement, it's your belief. What's your belief, it's your statement. So you'll tell me what that number is. I would say if I had to answer the question is, what average number would people say? I would say maybe a 6. But anyway, you'll indicate that, and I'll lead you back through some relaxation, and then we'll go through the same steps again, meaning that I'll instruct you that I'm going to turn the TheraTapper off for another 45 seconds to a minute again. And as I do so, I want you to really breathe into that belief, that positive statement, take it in, believe it because it is true. It's a true statement. Just really take that in as much as you can. Let it permeate every aspect of you. So you'll be instructed to do that again. I'll turn the TheraTapper on. And then when I get to the end of that time period, 45 seconds or so, I'll turn it off. Again, a little bit more deep breathing and relaxation. And then I'll ask the same question on the scale of 0 to 7, with 7 being that you totally believe that statement. What level of belief would you put on that statement? What number would you say? If we're not there to 7, then we'll keep going. Typically, people are there by the second or third time. And if we see that, or I see that, even by their body language. Sometimes they'll be smiling, and you can tell that they really have been successful in changing that negative belief into a positive belief. So that's a very powerful moment for you as the client. And at that point, we're almost done. So we do a little bit more in the relaxation place. People typically really enjoy the safe place. It's your safe place, and so you pick the place where you feel the most comfortable. And we'll do some things, have you describe some happy things that are going on, some joyous things, simple things like the weather's perfect, and if there's sun on your skin, it's not too hot and not too cold. It's perfect, it's just right. If there are other people there, family members, they too are relaxed and calm and peaceful. We talk about letting you have almost a joy meter or a happiness meter where you can let yourself. I like to use the analogy of a dimmer switch. I have you turn that dimmer switch up, make it brighter and brighter, and that brightness represents happiness and peace. And at this point, people are pretty happy, they're pretty in their safe place. And a lot of times, even we get to the point where when we leave the safe place and heading back, coming back into the room, a lot of times they don't want to leave that safe place. So, which the good news is they don't have to. It's always, as I said earlier, the ultimate goal is to take that inside of you where we can't call on it any time of the day or night. And we will immediately feel more calm and more relaxed as a result of reconnecting with a safe place. So we've reprocessed the trauma. We've completely turned the negative self-belief into a positive belief, and done a little bit more, spent a little bit more time in a safe place. And then it's time to leave that safe place. You're instructed to breathe that inside of you and to come back into the room at a nice, slow, comfortable place that feels comfortable for you. So it's your pace and your timing. So you will slowly come back into the room, and you will open your eyes and you will tell me about the experience. And that is basically how an EMDR session is done. And again, what I can tell you, the good news is, it's absolutely amazing. It always works, and the results are amazing. If this seems like a treatment protocol that you may have more interest in, or if you would like to make an appointment, a lot of times especially when we've been traumatized, The hardest time to make a decision, or the worst time I like to say, is tomorrow. And so therefore the best time is always today. There's a reason that you're connecting with this video. There's a reason that you're on the website. So I would encourage you to go ahead and call now. And the number is, as you can see on the website, is 614-880-9800. So please give us a call. We have 4 people now who are trained to do the EMDR, so we'll be able to get you in relatively quickly, and you can begin your journey to finding peace and getting free from the trauma. So thank you for listening.